Hi there, I'm Dr. Chung and welcome to your friendly proctologist. Welcome back to the space, and I hope that you're dealing the best that you can. Somebody asked about the lateral internal sphincterotomy recovery, or LIS. Whew, long word, but I have the link up here and down below in the description if you want to know the background, how that surgery is done, what is done. This person wants to know, why is it so dang painful? And the second is, how long should the recovery take? And those are great questions, and I fully recommend you discuss this with your surgeon before you go on the surgery journey of the recovery. So the recovery should take about 2 to 3 weeks in my opinion. Why? Because the surgeon usually makes an incision about 2 to 3 centimeters long. And then they remove, or they don't remove, they cut some of that internal muscle, right? And you're gonna have inflammation inside the skin where the cut was made and at the muscle where the injury, the cut of the muscle was done, right? So because of those injuries need some time to heal, but because they're so small, typically about 2 to 3 weeks, I would say nearly 100% of that wound should be healed at that point, and the inflammation from those injuries should be pretty much almost resolved at that point, okay? You're going to have scar tissue after the healing is done, and it's going to feel stiff, but most of the healing of the inflammation should be gone, okay? And it's a lot better than something like a hemorrhoidectomy, for example, because in hemorrhoidectomy you might have 3 or 4 cuts, and they're usually longer from the inside of the anus to the outside, and with them being multiple, yeah, that kind of adds on the pain. But the sphincterotomy, like a cut that big, if everything goes as planned, you shouldn't have a very long recovery. Now, what about the pain? And the pain aspect is a different story, right? So after the surgery, because of the fact that we made some cuts on our bottom end, cut the muscle, that stuff hurts. Why? Because the inflammation comes in. The nerve endings on the outside of our anus are super painful and sensitive. So yeah, very painful at the beginning, but as time goes on, that pain should get less and less and less. With pooping, it's going to probably irritate the area, right? And so you may get little bumps of pain that go up and down with the recovery. But at about 2 to 3 weeks, that should pretty much all be done with. All right. Now, why would it not be? Why would the wound not heal very well or in time? Sorry, the English is kind of tough language. And then why would my recovery be longer? Well, you may have had a complication. For example, if you had an infection after the surgery, that can delay wound healing. So you're going to have pain. The cut's not healed yet. And the other thing too is there's going to be inflammation there because of the infection. That hurts. And the other thing that could be happening is that you have anal spasming happening. And when the muscle is squeezing that hard, especially after really any anal surgery, you can have this condition. That will make your recovery longer. The pain will still stick around. And one thing that I caution patients about is if you have anal spasm before the surgery might actually make it worse. And that's the LIS included. Okay, I see it time and time again. I'm going off on a tirade a little bit because I see it so often, and I'll leave it for another video. But to answer your question, it's a very good one. The recovery should take about 2 to 3 weeks in my opinion. And then the other thing is, why is it so painful? Well, it's in the sensitive area of your bottom end. Please see your surgeon. Make sure your wound is doing well and recovering well. And if there's problems, definitely let your doctors know. Thanks so much for tuning in. I'll see you in the next one. Bye-bye.